Welcome to the Deep Dive. Today we're plunging into a topic that, well, might seem quite specific at first glance, female cattle infertility. But as we'll see, there are incredible layers of complexity here and some really surprising insights. It's definitely not just a niche veterinary issue. No, it has this profound ripple effect across, really, an entire industry. So for this deep dive, we've waded through quite a range of sources, scientific reviews, practical management guides, the whole lot. Our goal, to give you that shortcut to being really well-informed on what is a critical challenge. Our mission today is to explore the intricate causes, the cutting-edge diagnostic tools, and the sort of holistic management strategies for female cattle infertility. And you'll quickly discover why it's such a significant hurdle, not just for livestock production, but also, really importantly, for animal welfare. Let's jump in. Okay, so let's unpack this a bit. When we talk about female cattle infertility, it sounds specific, right? But the scale of the impact is, honestly, it's staggering. Just think about the numbers for a second. In the U.S. alone, reproductive disorders, and that lumps together infertility, abortions, difficult calvings, dystocia, it all adds up. We're talking approximately $1 billion annually.
$1 billion? That's huge.
It is. And get this, that financial burden actually exceeds 6 times the losses from respiratory diseases.
Wow. 6 times? That really puts it in perspective.
Doesn't it? And infertility, just by itself, is the single largest economic drain for beef producers.
Makes sense. A cow that doesn't conceive. Oh, there's no calf, no revenue, just costs piling up for another year.
Exactly. Feed, care, all with no return. And the costs are pretty direct. Even a tiny, 1% drop in pregnancy rate, that can cost a producer $5 per exposed cow. Bump that up to a 15% decrease, and you're looking at $75 per cow.
Ouch.
Yeah. And an abortion, the cost there can shoot up to $1,280 per case. Even a difficult birth dystocia can cost anywhere from, say, $145 to $400.
And that's not even counting the impact on future production, like milk loss.
Right. It slashes milk supply in a dairy cow by over 600 pounds in her first lactation alone. But, it's not just about the dollars and cents, is it?
No, absolutely not. The welfare implications are significant.
These conditions impose serious pain and stress, both for the mothers, the dams, and their calves. For the calves, a difficult birth often means prolonged lack of oxygen, acidosis, reduced vitality.
They're just weaker, struggling from the start.
Yeah, and they're apparently 6 times more likely to get sick than calves born easily. Most deaths happen within the first 96 hours.
And that difficult birth compromises the suckle reflex too, right?
It does. So they're delayed in getting that absolutely critical colostrum, that first milk.
Which just opens the door to all sorts of neonatal diseases. Scours, pneumonia.
Navel ill, yeah. And for the dams, the mothers, dystocia is described as one of the most painful conditions they endure.
I can imagine, especially severe cases needing C-sections, the pain scores are apparently very high.
And it leaves them vulnerable to injuries too, like uterine prolapse, tears, and then subsequent infections. Metritis, retained placenta.
All of which hammers their future fertility. It can even change how they behave towards their calf. So if we connect this to the bigger picture, it's clear these aren't isolated incidents, are they?
Not at all.
They create this profound cascading effect. Financial losses, welfare concerns. It just ripples through the whole herd's well-being and ultimately its profitability.
Yeah, it's a truly systemic problem.
Yeah.
Hits every part of the farm's operation. That's a really powerful way to put it. So, okay, what does this all mean when we try to figure out the causes? Because infertility isn't just one thing, right?
Exactly. It's a complex puzzle. Lots of different pieces.
Let's start with maybe the structural or functional roadblocks, like free Martinism.
Ah, yes, the co-twin situation.
Right. So a heifer calf, born twin to a bull calf, they share blood supply in the uterus.
And the female gets exposed to male hormones.
Which basically stops her reproductive tract developing properly. You see different levels of masculinization. Maybe an abnormal vagina, or ovaries that just don't function.
And there's no real treatment, is there? They're usually culled.
Typically, yeah.
Yeah.
And there are other congenital things, too, like segmental aplasia, bits of the tract just missing, or maybe double cervix.
Structural issue.
Then you've got things like follicular degeneration or cystic ovarian disease.
Often linked to hormonal imbalances, stress, maybe metabolic problems.
Yeah, you end up with these follicles on the ovary that grow but don't release an egg. Anovulatory follicles, they call them.
Throws the whole cycle off. Irregular cycles or no cycles at all.
And sometimes weird behavior, too, like nymphomania or acting more masculine.
Right. Then there are the pregnancy-related disorders.
Like early embryonic death, often linked to infections like BVD virus or maybe poor nutrition or stress.
And repeat breeder syndrome, that's a frustrating one.
Isn't it? The cow seems to cycle normally, but just fails to conceive after 3, maybe more inseminations.
Yeah. Very costly, very frustrating for producers.
Okay, but here's where it gets really interesting, I think.
Yeah.
And often, like you said, frustrating. Some of the biggest threats are, well, they're invisible.
The silent ones.
Exactly. Imagine a disease just creeping through the herd, causing widespread, but maybe subtle damage. Which brings us to bovine chlamydiosis.
Ah, chlamydia. Very prevalent.
Incredibly so. Globally. Herd seropositivity rates, that's the percentage showing exposure, can range from 45% to, get this, 100%.
Wow. So potentially everywhere.
Pretty much. And the really critical thing here is the high prevalence of subclinical infections, clinically inapparent.
Meaning the animals are infected, possibly shedding the bacteria, but showing no obvious signs of being sick.
Precisely. But even without obvious signs, these infections have a substantial impact on livestock productivity. Reduced growth rates, infertility.
And the sources say these subclinical infections are actually considered economically more important than rare outbreaks of severe disease.
Because they're just constantly dragging things down unseen.
Exactly. It's an insidious train.
So chlamydiosis can show up overtly, right? Things like abortion, stillbirth, uterine inflammation.
Pneumonia, and even that neurological condition in calves, SBE, sporadic bovine encephalomyelitis.
And it's shed everywhere, through almost all bodily secretions, especially feces.
Which makes it really hard to control. Very persistent in the environment.
And here's a really important point for everyone listening. The zoonotic potential.
Yes, the risk to humans.
Chlamydia abortus and Chlamydia psittaci can cause severe illness in people, especially pregnant women. There's a documented risk of abortion.
That's a critical public health aspect.
Definitely. Now, beyond chlamydia, there are other major infectious players, aren't there?
Oh, absolutely. Leptospirosis is another big one.
Causes abortion, reproductive failure. And the problem there is chronic carriers, right?
Yes, infected cattle can just keep shedding it silently.
Then you've got trichomoniasis and campylobacteriosis.
Both venereally transmitted, STDs of cattle, essentially.
Causing temporary infertility, early embryonic death. And the bulls are often the culprits, aren't they?
Frequently asymptomatic carriers. They look fine, but they spread it with every mating. Silent spreaders.
And bovine viral diarrhea virus, BVD. That's a major viral cause of conception failure, early death, even those devastating abortion storms.
And the really crucial thing with BVD is its ability to create persistently infected animals, PI calves. Right. They get infected early in gestation, survive, but then shed massive amounts of virus continuously throughout their lives.
Total virus factories.
Yeah.
Huge source of infection for the whole herd.
Then there's IBR, infectious bovine rhinotracheitis, another common viral cause of abortion.
And neospora, often linked to fetal losses.
And spread by dogs and wild canids like coyotes and foxes.
Yeah, the cycle involves those definitive hosts. Finally, things like anaplasmosis or even nitrate toxicity.
They mess with the blood's oxygen supply.
Exactly. Reduce oxygen carrying capacity, which can lead to fetal death.
Wow. So many different infectious angles.
What's truly fascinating, or maybe worrying, here is how many of these pathogens establish carrier states.
Yeah, you mentioned that with lepto and trich and BVD PIs.
Right. It means apparently healthy animals can just silently keep these problems going within the herd. Diagnosis becomes really challenging, and their true impact stays hidden.
Which raises that crucial question you posed earlier.
Exactly. How do you effectively manage something you can't easily see? That's a profound point. And it leads me to wonder, what's the biggest challenge in convincing producers to actually, invest in tackling these unseen threats, especially if the losses are maybe subtle or just add up slowly over time?
I think it often comes down to demonstrating that cumulative cost. It's not always about the dramatic, headline-grabbing outbreak.
Right.
It's more about educating them on that persistent, ongoing drag on productivity these silent carriers create. They're like an invisible tax on the herd's potential.
An invisible tax.
Oh.
I like that. I can see why it might be a tough sell initially, though. Okay, let's pivot now to something maybe more visible but equally complex, the calving conundrum. Dystocia. Difficult calving.
A major issue, no doubt. Leading cause of calf loss.
Yeah.
Significant economic impact.
And the definition is pretty simple. An abnormal or difficult birth that needs help. Intervention.
But the prevalence varies quite a bit, doesn't it?
It does. Much higher in primiparous heifers, those first calvers. We're talking 10–15% of cases, maybe even up to 32% in some dairy studies.
Compared to mature cows where it's much lower.
Yeah, down around 3–5% for mature cattle.
And the causes are, well, it's rarely just one thing, multifactorial.
Exactly. So important to stress how interconnected these causes are. Let's break it down. Maternal factors are a big piece.
Like the classic fetal-maternal size mismatch, calf too big, pelvis too small.
Especially in those heifers that are still growing themselves. Or maybe the mother is overconditioned, too much fat around the pelvis, narrowing the birth canal.
Right. Other maternal things. Weak contractions, uterine inertia, cervix not dilating properly, pelvic shape abnormalities.
Age and parity again, those first calf heifers are highest risk. And even if she's had dystocia before, that increases her risk next time.
Then there are the fetal factors.
Obvious one is just fetal oversize, linked often to calf sex, sire genetics.
Yeah, using bulls known for throwing big calves on smaller heifers is asking for trouble.
Definitely. Or the calf's position, malpresentation, malposition, malposture. Basically, not coming out head and front feet first.
Breech presentation, leg back, head turned, all sorts of variations.
Rarely, you might have fetal abnormalities or even fetal death contributing.
And then there are the management factors,
Oh,
the human element.
Crucial. And both extremes are bad, right? Overfeeding during gestation can lead to huge calves or that pelvic fat.
While underfeeding weakens the cow, she doesn't have the strength for labor.
Poor sire selection we mentioned. Not developing heifers properly before breeding them.
And then the actual calving management, failure to watch closely, and intervening too late.
Or intervening too early, maybe.
That too, potentially disrupting things. Unclean calving environments increase infection risk. Lack of exercise.
That all adds up.
It really does.
And this is where, like you said, it becomes this comprehensive deep dive. It's not just one isolated issue. It's a dynamic web.
Yeah.
Like your example, overfeeding a heifer that's management leads to fat deposition in the pelvis that's maternal, which then makes even a normal-sized calf fetal factor harder to deliver.
Exactly. It all compounds. One thing influences another.
Okay, so given this incredibly complex web, how do vets and producers become detectives? How do they figure out what's actually going on? The diagnostic tools must be getting pretty sophisticated.
They really are, though the traditional methods are still foundational.
Like clinical examination, just careful observation.
Absolutely. Rectal palpation is still a cornerstone. For early pregnancy diagnosis, you can feel it around 28–35 days.
And assessing the ovaries, corpus luteum, follicles, checking the uterus for infections like metritis or pyometra.
Exactly. It gives you a lot of information right there. And the vaginal examination can reveal trauma, inflammation, structural problems.
And just watching the calving process itself is critical for spotting dystocia early, right? Knowing the stages of labor.
Crucial. And knowing those intervention timings, like if the water bag appears and there's no progress within an hour.
Or if a heifer is straining hard for 2–3 hours, or a mature cow for an hour with nothing happening.
That's when you need to investigate. And looking for those observable signs, maybe only 1 foot showing, or a breech presentation, or signs the calf is stressed, like meconium staining.
That dark, sticky fecal matter?
Yeah, indicates fetal distress, time to act.
Okay, so beyond observation and palpation, the lab tests get more specific.
Definitely. Hormonal assays are widely used. Progesterone P4 testing is great for early non-pregnancy detection.
How does that work?
Well, if a cow isn't pregnant, her progesterone levels will drop around 18–24 days after insemination. Low P4 then is a reliable sign she's not pregnant. Helps identify open cows sooner.
Got it. And what about AMH, anti-Mullerian hormone? You hear more about that now.
Yeah, that's an emerging biomarker. It's like getting a peek into her ovarian reserve or future fertility potential.
How so?
AMH is produced by the small developing follicles in the ovary, so higher AMH levels generally correlate with a higher number of these follicles, predicting better fertility, embryo yield in IVF programs, maybe even conception rates.
Interesting. It's sort of like a fertility forecast.
In a way, yes. Still being refined, but promising.
And for those sneaky infections, molecular diagnostics are key now.
Absolutely. For chlamydiosis, PCR polymerase chain reaction is really considered the first choice method.
Because it finds the actual bacterial DNA.
Exactly. It's like a molecular magnifying glass. Super sensitive and specific for detecting the pathogen itself, not just antibodies from a past infection, which serology shows.
And you mentioned culturing chlamydia is hard.
Very difficult, slow, and less sensitive. PCR is much better.
And for trichomoniasis.
qPCR, quantitative PCR, offers even better sensitivity and specificity than the old culture methods, and much faster results, usually 2-3 days.
It makes a big difference for managing outbreaks.
Huge. And uterine biopsy or cytology, taking a small tissue sample or cell smear from the uterus, can diagnose things like subclinical endometritis.
That hidden uterine inflammation.
Yeah, even when an ultrasound might look relatively normal, it gives you a clearer picture of uterine health.
This is really where we see that shift you talked about, isn't it? From just reacting to problems to being truly proactive.
Precisely. The goal isn't just treating after a problem hits, but trying to prevent it by understanding the subtle nuances of an animal's health before it becomes a crisis.
Makes sense. And the future is really here now with some of these advanced reproductive technologies and novel tools. Ultrasound, for instance.
Right. Real-time B-mode ultrasound is still the gold standard for early pregnancy diagnosis, say 26-28 days post-ovulation.
You can check viability, see the heartbeat.
Yes, assessing embryonic or fetal viability is a key use. And Doppler ultrasound, looking at blood flow, can potentially detect non-pregnant females even earlier, maybe 20-22 days.
Wow. And genomics. That seems to be changing everything.
It really is revolutionizing cattle breeding. The sources say it's literally doubling the rate of genetic gain.
Doubling it. How?
By allowing us to identify animals with superior genetics for traits like immune function, disease resistance, and fertility much earlier and more accurately than before.
So you can make smarter breeding decisions. Predict things like calving ease or abortion risk based on DNA.
Exactly. Much more evidence-based breeding programs. It's a powerful tool.
And what about these sensor technologies for calving? That sounds amazing.
It's part of precision livestock farming, real-time monitoring. These tail-mounted devices, for example, can predict calving with pretty high accuracy.
How much warning do they give?
Usually notify the producer about 1 to 3 hours before calving starts.
That's huge for being there if there's trouble.
Absolutely. Studies show it can significantly reduce calf mortality associated with difficult calvings, potentially by up to 50%.
50%.
Oh.
Just by being alerted sooner.
Yeah. And other sensors monitor calf health signs, temperature, activity levels. They can potentially detect diseases like pneumonia or scours days before you'd see clinical signs.
Getting ahead of the curve.
Totally. Then there's novel semen analysis, acoustofluidics.
Sounds complex.
The tech is, but the idea is using tiny sound waves to sort and analyze sperm very quickly and objectively, potentially much faster and maybe more accurate, up to 93.7% accuracy reported, than traditional expensive systems. Still emerging, but interesting.
And PEGs, pregnancy-associated glycoproteins.
Yeah, these are proteins produced by the placenta, detectable in the mother's blood very early, maybe 19-21 days post-breeding.
So another early pregnancy marker. And they indicate viability too.
Yes, they serve as biomarkers for both pregnancy confirmation and assessing embryonic viability. Lots of tools in the toolbox now.
Okay, so armed with all that diagnostic power and understanding the complex causes, what can actually be done? It sounds like prevention is really where it's at.
Absolutely. Prevention is, without doubt, the most cost-effective strategy in the long run.
So where do you start? Herd health, biosecurity.
Foundational. Implementing robust protocols, things like quarantining any new or returning animals ideally for 21 to 30 days.
And testing them during quarantine. For things like BVD PIs.
Critically important. Strict control over animal movement onto and off the farm. Meticulous sanitation of equipment, facilities.
Wildlife and pest control too. Thinking about disease spread.
Yes. Proper carcass disposal. And crucially, identifying and removing known carrier animals from the herd. Breaking that cycle of silent spread.
Makes sense. Vaccination programs.
Another cornerstone, developing targeted schedules against the key reproductive pathogens, BVD, IBR, lepto, campylobacter.
And understanding the difference between vaccine types. Modified live versus killed.
Yes. MLVs generally give quicker, stronger immunity but need careful use, especially around pregnant animals depending on the specific vaccine and prior exposure. Killed vaccines are safer for pregnant cows but often need boosters.
And you mentioned chlamydia vaccines are available now, too.
Yes, commercial bivalent vaccines exist, though developing highly effective chlamydia vaccines has been challenging historically. Proper storage and administration of any vaccine is also key.
Right. Got to handle them correctly. What about genetics? We talked about genomics for diagnosis.
Also crucial for prevention. Using genomic selection tools and EPDs, expected progeny differences to pick sires and replacement heifers.
Selecting for fertility, low birth weight, high calving ease.
Exactly. Avoiding breeding animals known to have heritable defects that could impact reproduction. Smart selection is key.
And nutrition. That came up with dystocia causes.
Absolutely critical for overall reproductive performance. It's a real balancing act.
Because both undernutrition and overnutrition are bad.
Definitely. Undernutrition delays puberty, reduces follicle development, weakens the cow. Overnutrition leads to those big calves, pelvic fat increasing dystocia risk, and can actually delay the return to cycling after calving.
So it's about balanced protein, enough energy, and those essential minerals and vitamins.
Calcium, phosphorus, zinc, selenium, copper, vitamins A, E, all play vital roles in reproduction. Getting the nutrition right is non-negotiable.
And then just good general management practices.
Yeah, the day-to-day stuff matters hugely. Focusing on getting cows pregnant early in the breeding season, making sure heifers calve at the right age, around 2 years old.
Stress reduction. That seems important.
Very. Stress hormones directly interfere with reproductive hormones. So low stress handling, comfortable environments, it all helps.
Providing clean, dry, protected calving areas, intervening early but appropriately in dystocia cases.
Meticulous record keeping. You can't manage what you don't measure. Tracking cycles, breedings, calving outcomes helps evaluate what's working.
Accurate heat detection, proper AI technique if you're using it.
All fundamental building blocks of a successful reproductive program.
Okay, so prevention is the goal. But when problems do happen, what about treatments?
Right. Sometimes intervention is necessary. For infections like chlamydiosis, it's primarily certain antibiotics, tetracyclines, macrolides, fluoroquinolones.
Administered early and for a decent duration.
Yes, often for several weeks. Supportive care is also crucial. For uterine infections like metritis or endometritis, systemic antibiotics are common.
But you mentioned research into alternatives.
Right.
Dextrose.
Yeah, for milder cases of endometritis, some research explores using intratortor and dextrose solutions as an alternative or adjunct to antibiotics. Still under investigation, but interesting.
And retained placenta. The afterbirth not coming out, what's the key there?
The absolute key is do not manually remove it. Pulling on it causes trauma, increases infection risk, and delays uterine recovery.
So what do you do?
Focus on treating potential infection with antibiotics if needed, monitor closely for metritis, and maybe use hormones like oxytocin or prostaglandins plus calcium to encourage natural expulsion, patience, and supportive care.
Got it. No pulling. What about treating dystocia itself? The difficult birth.
Timely and appropriate intervention is critical, saves lives, dam and calf, and minimizes long-term damage.
Starts with assessment, figuring out what's wrong.
Yes, assessing the stage of labor, signs of distress, determining the cause if possible. Hygiene is paramount: thorough washing, obstetric lubricant, proper equipment.
Then trying to correct malpresentations.
Yeah.
Like a leg back.
Manual manipulation is the first step. Gently repositioning the calf. Sometimes an epidural anesthetic helps relax the cow, making manipulation easier.
And if you need to assist delivery, traction.
Assisted vaginal delivery, yes, but applied gently, with controlled force, synchronized with the cow straining. Generally, no more force than 1 or 2 people can apply manually.
What about mechanical calf pullers? Calf jacks.
They need to be used with extreme caution. They can generate enormous force and easily cause severe injury to both the cow and the calf if used improperly. They have their place, but require skill and restraint.
Okay. When are surgical interventions needed?
Cesarean section, or C-section, is indicated if the calf is simply too big, the cervix isn't dilated, or you have a malposition you just can't correct manually, often doable right in the field. And phytotomy. That's for when the fetus is unfortunately dead. It involves carefully dissecting the dead fetus within the uterus to remove it in pieces. It sounds gruesome, but it's often less traumatic for the cow than a C-section or forceful extraction of a dead, possibly oversized or malpositioned calf.
Okay. And episiotomy.
That's a surgical cut made to enlarge the vaginal opening, sometimes needed in specific situations, but less common than C-section or phytotomy.
And after a difficult birth, the care doesn't stop there, right?
Yeah.
For the dam or the calf?
Absolutely not. Post-dystocia care is vital for the dam, fluids, good nutrition, close monitoring for uterine infections, trauma, nerve damage, often antibiotics, and pain relief, anesthetics.
And for the calf, what are the immediate priorities?
Clear the airways immediately, stimulate breathing, and importantly, avoid hanging tabs upside down. That old practice can actually hinder breathing by compressing the lungs.
Good to know. Then colostrum.
Immediate high-quality colostrum. That's non-negotiable.
Yeah.
Ideally, 3 to 4 liters within the first 6 hours of life. Absolutely critical for immunity.
Keep them warm.
Maintain thermoregulation, yes. And then just monitor them really closely for the next 2-3 weeks for any signs of illness, injury, or failure to thrive. They're higher risk.
This really brings up that important point again, doesn't it?
Yeah.
We can treat these things.
But a truly effective management strategy has to integrate these treatments within that broader preventative framework we discussed.
Right. Focusing only on treatment means you're just putting out fires.
Exactly. You're addressing symptoms, maybe saving individuals, but not breaking the underlying cycle of problems in the herd. It's got to be about building resilience, minimizing the need for these costly, often difficult interventions in the first place.
Wow. What a journey. This deep dive into female cattle infertility, it really touches on everything, doesn't it? Genetics, nutrition, bugs, technology, welfare.
It's incredibly multifaceted.
The sheer complexity is astounding, but, so is the potential for solutions, which is encouraging. So, just to recap for everyone listening, female cattle infertility isn't just, a lost pregnancy here and there. It's a massive billion-dollar annual burden in the U.S. alone, with really significant animal welfare implications tied up in it.
Right.
We've explored how all these interconnected factors, from those invisible subclinical infections like chlamydia, just silently dragging things down, to the very physical, obvious challenges of dystocia, how they all weave together to create this profound challenge. But we've also seen some incredible advancements. Diagnostics are getting so much smarter, genomics, those amazing calving sensors.
Real game changers, potentially.
Alongside those vital preventative strategies and management practices that offer real hope and actual, tangible solutions for producers.
And I think this really underscores that success in modern livestock production isn't about searching for quick fixes or silver bullets. It's about committing to a holistic, integrated herd health management plan. Every single choice, really, from which bull you select to how you manage nutrition, right down to ensuring a calf gets colostrum in its first few hours, it all has a ripple effect. It impacts long-term fertility, profitability, everything.
So it's about designing a system where the animals can thrive.
Ultimately, yes. Enhancing their well-being inherently enhances productivity. It's about creating resilience within the system.
So thinking about all this, here's a final thought for you, our listener. If we can use these sophisticated tools, genomics, real-time sensors, to predict and prevent something as complex as infertility in cattle, what does that teach us about the power of proactive health management in other complex systems, maybe even in our own lives, when we're faced with overwhelming information or hidden challenges?
Yeah.
Something to think about.